My name is Kathleen Caper. This is video number 1 for assessment. We have here a patient as a 14-year-old white female. She's well nourished, appears stated age. She's ambulatory. Her speech is clear. She's pleasant and cooperative, understands questions and commands. When she speaks, she uses appropriate tone and volume and quality of voice. Her hair in person is neat and clean. Her vital signs have already been done, including height and weight, and they were within normal limits. Okay, so to assess her skin, hair, and nails, look at me. Her skin is pink, well perfused, smooth and soft, warm and dry. There are no visible lesions. She does have just a few freckles. Her skin turgor, within normal limits, and her skin is clean. Her nails, they're transparent, smooth and clean. The nail beds are pink and translucent with translucent white tips. Cap refills less than 2 seconds. The cuticles are smooth and intact and without edema. And adherence to the nail bed is intact. Sorry. So her hair is uniformly brown in color. It's evenly distributed. Flexible texture. It's fine and soft and clean. Her scalp is intact. No lesions, bumps, or masses. And she does not shave. In her eyes, the palpebral fissures are symmetrical. Her eyebrows are also symmetrical with normal hair distribution. The lids do not cover the pupils. You can't see the sclera above the eyelids. Above the iris. Her blink reflex is within normal limits. The eyelashes are equal, normal distribution. There's no inflammation, redness, ptosis, or tremors when looking at the eyes. The sclera are white, no hemorrhaging, and the conjunctiva is pink without any edema, redness, or lesions. I'm going to feel here, any tenderness? No? No tenderness of the lacrimal duct or any edema noted. Testing accommodation. I need you to look at. Okay, accommodation is intact. Check your pupils. Pupillary reflect is also equal and intact. Now we're going to check your extraocular movements. I want you to follow my finger. Okay. There's no extra movements, no strabismus or nystagmus noted. Cornea, which I want you to do more. I want you to look straight forward. I'm going to check your cornea. Let me do it from the side so on the video. Yeah. Just look forward. Okay. The cornea. There's no cloudiness or abrasions. The iris is brown. There's no, look straight forward. No bulging of the cornea either. So we're going to pretend this is my ophthalmoscope. Check your red reflex. I just need you to look straight forward. Okay. Positive red reflex. And then I'm going to move in closer. Actually, I'm going to move in closer. The lens is clear. The retina appears red. The blood vessels emerge from the nasal side of the disc. The disc is sharp and well defined. The physiologic cup has half the diameter of the disc. Okay, so now we're going to check your vision. There's letters on here. Okay, so I want you to cover one eye. Okay? And I want you to read this line here. Just say some letters.
E-K-L-G-B-T-Y.
Okay. Now, switch and do the other eye. Read the same line, please. Just
E-K-L-G-B-T-Y.
okay. All right, I want you to cover one eye. Okay, I want you to follow his finger. Okay, can you do it with the other eye, please? Okay, all right, there's visual fields are intact. And then what we're gonna do is we're gonna do this cover uncover test. See if there's any strange. So I want to cover your eye. You look forward. And okay, there's no movement of the opposite eye. No strabismus noted. For the head, her head is symmetrical in size and shape. There's no involuntary movements of her head. It's upright, is midline to the trunk, and there's no nodules or masses, as we already felt when we checked the scalp. Her face is symmetrical in shape. The nose is symmetrical in the middle of the face. Mouth is symmetrical as well. Can you raise your eyebrows for me? Okay, symmetrical movement of the brows. Smile. Okay, equal symmetrical smile as well. There's no unusual features. Check your sinuses here. I want you to tell me if anything's tender. Here? No? Here? Okay, no tenderness. And there's also no edema or masses of the sinuses. We're going to check your fine sensation, okay? So I want you to tell me just if you feel this. Okay, this, okay, that, okay. So sensation is intact. Now what I want you to do is clench your jaw. Okay, just clench your jaw shut. I'm going to feel here. Okay. Now I want you to open your mouth. Okay. Now move side to side, your jaw, like this. Your chin. There you go. Okay, good. Masseter muscles intact. Now, let's see, we already did raise your eyebrows. Close your eyes tight. I want you to hold them closed. Okay, can't open them. Show your teeth. You smile. Puff your cheeks out. Frown. Frown. Like sad. Okay, so cranial nerve 7 is intact. Alright, so her neck. What I want you to do, I'm going to put my hands on here. I'm going to push down a little bit. I want you to shrug your shoulders up against my hands. Okay? Now, I want you to move your head this way. No, like do this. Push against my hand. Like with your neck. Okay? This one? Okay. Sternocleidomastoid muscle is intact within normal limits. And can you move your neck side to side, up and down? Okay, full range of motion. There's no masses or scars on the neck. The trachea, I want you to just kind of relax. Just relax. There you go. Trachea is midline. Okay, there's no masses felt. There's no scars there. There's no protrusions. Okay, we're going to feel your thyroid. Right here. You gotta relax. Is it tickle? Okay, kind of relax. I want you to just relax and kind of sit. Okay, your thyroid. There's no enlargement. Is it tender when I touch there? No? Okay. Now I'm going to hold you. I want you to swallow. Okay, normal up and down movement. Sorry. And then we see your carotid artery. Okay, there's no asymmetry or any bulging of the carotid artery. Now I'm going to check your lymph nodes. I'm going to feel up here behind there, not feeling any. Any swelling? You're very ticklish, I know, I'm sorry. Okay, no swelling of the lymph node. Feel right here too. Okay, no edema, no tenderness, right? Nothing hurt? Okay. All right. So now we're going to check your ears. You can put that back in. Make your ears easier. Okay. Okay, so the ears, okay, the auricles are smooth, firm, mobile. There's no lesions. Okay. They're equal size, they're level. They sit at a 10-degree angle, and they're even with the palpebral fissure. Now I'm gonna look at your ear. Can you turn for me? Okay. There's no no redness, no excessive cerumen noted. Sorry, no edema. So now I'm gonna look in your ear with the otoscope. My makeshift otoscope. Right, I'm going to just pull up and kind of back and look in. Okay. So the tympanic membrane is pearly gray and translucent. There's no tears or break. The malleus is oblique behind the upper part of the eardrum. And there's the shiny cone of light. I'll look at the other one. Cone of light. Okay, I'll check this one. Also translucent gray, pearly white. Everything's intact. Okay. Now we're going to check your hearing a little bit. We're going to try this whisper test. What I want you to do is take your finger, put it in your ear, and wiggle. Wiggle it. And then I'm going to say something to you over in this ear. Tell me if you hear it. Or you repeat it.
10 dogs. 10 dogs.
Okay, let's do the other ear.
8 cats.
Okay, good. Intact. All right. So let's look at your nose. Oh, I wanted to do one other test. I want to check this is my tuning fork. Okay, I'm going to make it vibrate, and then I'm going to put it right here on your head. I want you to tell me if you hear it in both ears, one ear, if one's louder than the other, okay? All right. Okay. Where do you hear it?
Equal.
Can you say it loud?
Equal.
Okay. Now I'm going to check over here. It's vibrating. I'm going to put it right here on the mastoid bone. Tell me when you stop hearing it. Just
Now.
okay. Now tell me when you stop hearing it.
Now.
Okay. Let's do it on this side. Tell me when you stop hearing it.
Now.
Okay.
Now.
All right. Great. Hearing is equal. So your nose, you're going to look at your nose here, okay? There's no masses. Does that hurt at all when I touch?
No.
No? Okay. What I want you to do is block one nostril and breathe in through your nose. Okay, other side. You're able to breathe in.
Ow, you bit me.
Mirrors are patent. You're not helping out. All right, so now we're going to do the smell test. I forgot to get some smell. Okay, do you tell me what that smells like?
Chocolate milk.
Okay, tell me what this smells like. Juice. All right, smell is intact. Okay. So now we're going to look in your nose with our otoscope. Okay. All right. So the nose, let's see. Mary's are patent. There's no edema. There's no discharge. Mucous membranes are membranes are pink and moist, and the septum is intact and midline. Okay. Now let's take a look at your mouth. So first we'll look at your lips. They're moist and pink, smooth. There's no lesions visible there. I'm going to look inside your mouth here. Use this little gauze so I don't touch your mouth. Okay. Mucous membranes are nice and pink. They're moist, intact. There's no lesions or edema. The teeth are intact Patient does wear braces. And the teeth are smooth. Open up for me. Smooth and pearly white and shiny. Okay, I want you to stick your tongue just halfway out. Okay? Okay, tongue is pink and moist. Top is kind of rough on the top, smooth along the lateral margins. Tongue is midline. Can you move your tongue around for me? Look up. There you go. All right, fine limb intact. And the salivary glands are within normal limits. Okay. We're going to look at your uvula and tonsils. Okay. So I just want you to open up. Just sit normal. Just, there you go. Okay. And then can you say ah? Okay. So there's no lesions or edema visible. The pharyngeal structures are smooth and pink. Sorry, I stuck it in your face. Movement of the soft palate and pharynx when the patient says ah is normal. And one more time. And the palate is also intact with no bony prominences. Thank you for your assistance.